Hi, I'm Tina Marie Tyler with MSN Entertainment, and I'm in Beverly Hills at the plastic surgeon to the stars, Dr. Haworth's office. Dr. Haworth is going to give me the skincare technique so that everyone can have red carpet skin. Tell me, what are some of the stars and celebrities doing to prepare for the red carpet?
Oh, that's a question I always get asked. There are many things that they're doing because they really want to have a very natural look that's quick and easy to come by with little pain. Of course, there are the old tried and trues like Botox. There's Restylane, there's the new Juvederm that helps plump up the face in a very natural way. And a lot of the stars now are coming in for Fraxel because you even see the result from this laser even after one go-round. And you're just sort of sunburned for about 3 to 5 days. And then you already notice that your fine lines, your brown spots, and your skin is noticeably tighter.
A lot of the nominees this year are people of color. Is there a difference when you treat a person of color in the injectables as well as the plastic surgery?
Not from the injectables. There's really no difference. There's no color barrier, whether you're yellow, black, or white. No problem whatsoever. But in terms of like the lasers, up till now, we could not employ indiscriminately, we could not employ any types of lasers on people of color, or people even of olive skin for that matter. But now with this new Fraxel, we can do anybody of any color on any part of the body with relative impunity.
Now, it's not just the women that have fabulous looking skin, it's also the men. What are some of the hot new procedures the men are getting this year?
I personally had 2 done because we had one in the office and the dermatologist did it to me and I did it to her and so on and so forth. And you know, there's no stigma related to plastic surgery anymore. But to be honest with you, I was underwhelmed by some of those new radio frequency procedures because, you know, let's put it this way. 60% in my estimate of all these new touted procedures turn out to be rubbish. 40% are really good, tried and true. One of them is Fraxel. I see real results. Patients are invariably happy, and they get real results with relatively small amounts of downtime. 3 to 5 days. Titan, Thermage. I saw it looked good for about 3 or 4 months, but then afterwards, I noticed that I was back down to ground zero again.
And we don't want that. We don't want the sag.
People want to, if the Titan or these radio frequencies, and here I am being a plastic surgeon, sort of poo-pooing certain things, and I had the damn machine, but the issue was that, you look good for a couple of months, 3 months, and if it was like $400 to $500, that would be fine. But the issue is that these Thermage treatments, Titan or Refirm, in my mind, my humble opinion, after several $1,000s, $2,000 to $3,000, I would be a little bit upset too if my results only lasted a couple of months. So, Tina Marie, I want you to make a mean face for me. Okay. So I think Botox would be perfect for there just to smooth some of that out, okay? Because you've got a really smooth forehead here, and when you do that, it sort of draws attention to it. And then I would do some meso Botox here because you don't really have deep lines, but it will give you a smoother look, but you'll still be able with meso Botox to move your underlying muscles. So you'll still be able to evoke expression. That might be important on the camera and so on and so forth. So when you raise this, the deep lines will be gone, but you'll still be able to move.
One of the reasons why you are so popular with the celebrities is because you're not only a plastic surgeon, you're also an artist. Tell me about how you blend the two of those things together in your practice.
Well, I think it sort of comes naturally, blending the two together. I don't have a strategic plan about, I'm now going to blend them together. I found that I've always wanted to be an artist before becoming a plastic surgeon. And plastic surgery